And it's just an easy conversation. Live stream. Okay, I guess we can get started now. Hi, everyone. My name is Miranda Romanowicz. I'm the CEO of the Ontario PSW Association and the host of PSW Podcast. And I am joined today with Natasha Bell, OPSWA PSW extraordinaire. I've known Natasha for a long time. In celebration of PSW Week that we are officially started, we kicked it off last night with our PSW Appreciation Night in Cambridge, Ontario. It was a great night, great award winners. But we're starting off with one of our veteran PSWs. And Natasha, thank you very much for being here today. I know that you're kind of iffy on wanting to come on here and talk to me, so I really appreciate the fact that you are. But I just wanted to talk about, because I've known you a long time. Yeah, like I really met you in the beginning of COVID-19. And so, I mean, we'll get into that in a minute, but why don't you tell everyone here who's watching a little bit about yourself?
Oh, I'm Natasha. I've been at PSW since 2018. I graduated from Georgian College in Owen Sound, and I've worked in long-term care, hospice, home care, the ER. And now I own a center for adults with special needs where we do programs and events and lots of fun. Yeah, it's been busy.
I bet it is. I bet it is. So, it was interesting that we were going to do this podcast today because last night when I was at the PSW Appreciation Night, I brought up COVID-19, and it was really an interesting dynamic of what I experienced with the PSWs because a lot of them are saying, no one remembers what we did through COVID-19. It was something that changed the landscape of the personal support worker profession itself, but it also changed a lot of PSW's lives. And so I'm going to boast about you just for a quick tick. Because so Natasha, so when we were in COVID-19, many of you guys on this page probably remember, but I mean, my COO Ian De Silva and myself were front and center with the government, and we were helping PSWs when there was no PPE, and we were, trying to get PSWs into long-term care homes that had no staff, and it was just an absolute nightmare. And so we created PSW SWAT teams is what we called them. And these SWAT teams literally deployed into long-term care homes across our province. And one of the first names on our SWAT team list was Miss Natasha Bell. And so, Natasha, tell us a bit about your COVID-19 experience, kind of going out deploying.
So I was a community worker at that point where I took my clients out into the community to do the fun stuff. And at that point, everybody got locked down. So I was at home and watching the news and hearing all the stories of people being, passing away, no staff walking out in these homes. Gut wrenching. It was absolutely horrendous. And every ounce of my body said, you've got to go. You got to help. So I do have 3 sons and a husband. And so I left them. First time ever. So it was a learning experience for them and for myself. But I knew I had to do it. And my husband and my kids were very supportive. He said, you got to go. We know you got to go. So I went.
So one of the first places you went to, if I remember correctly, was Ottawa. Am I correct on that? Yeah.
Yeah.
So what did that look like? How long were you guys there for?
I want to say we were there 3 months, roughly 3 months. Yeah. It was scary. It was scary walking through those doors. I mean, I didn't know anybody, we just, and then working together and stuff, we met each other. We were all staying in a hotel. And we're all still really good friends. But walking in there and just seeing the state that they were in was it was heartbreaking. No staff, no PPE at first.
Well,
That was scary,
yeah,
residents in their beds, isolated in their rooms. We lost a fair amount in that home. That was devastating. The worst part of it was their families. They couldn't be there. They couldn't be in there. We were grieving people we didn't even know. But
yeah.
we held their hands, we sat with them, comfort them as much as we could. And it was heartbreaking.
Absolutely.
Yeah.
And for, it's interesting to meet new PSWs that graduated after COVID and are coming out into this workforce. And it's definitely a different dynamic out there now. And I think, you sharing your experience working as a COVID-19 warrior, because that's what you were, so you are, that always stays with you. Um, it is something that PSWs need to hear again. But not only PSWs, but the public needs to
Yeah.
hear again. I mean, from my standpoint, I was forced to stay in my seat at the computer. I did want to go back into the field. That was my first thing, was I gotta go. And I obviously couldn't. But I mean, just watching and talking to you, and you guys, when you guys were out in Ottawa, and experiencing those things through your eyes, and knowing what was happening. I mean, the association itself lost 11 of our members to COVID-19 through some of the hardest times of COVID. And that in itself was hard as well. So, it's so, I mean, you have this whole experience. How many times did you deploy? Because I forget now.
I think we did 2 or 3. We went to Alliston, like Beaton area, for a couple months as well.
Yeah.
Again, same thing. At least we had a little more like the PPE and stuff like that. But in both deployments, the hospitals ended up, coming in and taking over infection control. We had palliative doctors working on the floor with us as PSWs. Like it was great to see how many people came together, to
Yeah.
help these residents and the staff and their management and stuff like it. It was really horrible but good in a sense that so many different people from different professions did come in and help and work together, to help these people. So that was great.
I
Absolutely.
think, I think, at least there was that silver lining. At least there was that, and I wish we still had that
Yeah.
today. Like I just, there was so much progression of the profession. There was so much recognition of the profession. There was so much growth of the profession. We really showed our worth and then some as PSWs through the COVID. And since, I mean, really truthfully, we do every day. But it's almost like when there's not a pandemic, people
People
kind of
forgot about
forget how
it.
important the PSW is,
Yeah.
right? But I mean, working alongside palliative doctors on the floor, working, I mean, I know PSWs worked alongside the military, like it was something that was unprecedented and something that we never, as personal support workers, I mean, I'm very certain that when you graduated, you did not go, I know this is going to happen and I'm going to just jump in head first, right?
Yeah. No. Not at all.
No, and you survived it.
Yeah.
And
No.
and your husband and your kids survived it.
They did. Yep. They learned how to cook and clean.
Purely, I'm sure, but they learned
Yes.
how to survive.
They may have forgotten the importance as well.
Yeah, well, there you go, right? So after COVID was all over, and the memories are never gone. So you moved forward as a personal support worker, and you're doing some pretty awesome stuff right now.
Thank you.
And I really want you to share, kind of, if you don't mind, kind of the build up to this decision to run the center, develop this center, and what your future goals are. And I just want to point out too, like, we were talking with Ian prior to this, just for our audience, and a lot of PSWs, like you said too, Natasha, you guys feel like all you can do is work in home care or long-term care, and that is so not true.
That's
You
right.
guys can work in so many places. And so with that, I'm going to let Natasha take it. So Natasha, please tell us all about your center.
All right. So I was working, doing some home care. I was working in the ER, and I was reached out to do some one-on-one with adults with special needs, as I used to work for community living. And so it started there, and it was kind of like being rejuvenated of remembering the passion that I love for this field.
Yeah.
So doing the one-on-one, working out of my home, working out of my car, um, I was getting more and more clients wanting to come and do these fun activities and stuff. So I thought, well, I need a place. We want to go cook, we want to bake, we want to do movies, we want to do crafts. My house isn't ideal. So on the search I went and I did find a space. So it started there, and I really didn't know how this was going to go. I had no idea. And then, putting all the pieces together, we're here. We do cooking, we do life skills, kitchen skills, outings, movie club. Movie club's a big hit. And they get so much joy from this. It just, it means so much to me. And seeing some who are maybe with, the headphones, maybe didn't want to socialize, not in large crowds, stuff like that. And I do have a client like that right now, where now he is doing co-op, he is enjoying the bigger crowds, he's not wearing your stuff like that. Just, it really gets me going. And I know this is exactly why I'm doing what I do, and the social aspect of this is huge for a lot of these people, right? So yeah, like I'm glad that we're here, we're doing this. Eventually I want to grow bigger so we can give more support and maybe a bigger place to call home. Do like more stuff, and then add, more staff and stuff to do like one-on-one, maybe some respite, stuff like that. So I have a lot of plans. It's just getting there.
It's always a walk. So tell me, is it just 18 plus? Is that what you primarily?
Well, right now, that's kind of, yeah, like that's where we were sitting. But I mean, my doors are always open, if families want to come in and chat, if they have someone who just needs some summer programming, and
Yeah.
want to come hang out, go to the movies, maybe do some baking, money management, stuff like that. So, my doors are open. If they want to come visit and chat, I'm open to it.
So what you're doing is something that is so desperately needed across Ontario that we don't have
Yeah.
literally anywhere. And so kudos to you. Kudos to you. So give yourself a plug right now. So what's the name of your center and how can they reach you?
Journey Center of Gray, and we're located in Meaford, Ontario. So check us out.
So what we'll do is put a link below under this podcast for people to find you. Absolutely. And I really appreciate you, Natasha, and I appreciate you taking the time today on a Saturday at 1 o'clock in the afternoon to sit down with me and just talk about, COVID. We ran through that pretty quick, but I think because you and I went through it,
Yeah.
right? Yeah. Yeah. Let's forget about making our face shields with old pop bottles.
Oh my goodness, yes.
That was
Only
the truth.
field. Oh my
Oh,
goodness.
it was the garbage bags. Oh
Hmm.
yeah. It
Yeah.
was, you know what, maybe sometime we'll do a whole series on, what PSWs went through in COVID.
All the
Um,
pictures too.
oh gosh, yeah. Nobody knew what you looked like.
No, that's right.
No, makeup not needed on those days, absolutely.
Yes. Yeah, yeah, that's true.
So I mean, I'm wondering right now if we have any questions or anything like that. Oh, there is a question. What is the acuity level of the care offered?
Okay. You want to expand on that a little bit?
So acuity. So like, what is do you take anyone from like high functioning autism all the way to nonverbal?
Yes. So I do have a couple who are nonverbal, um, which they still communicate. They have their little things, right? You ask them, "Do you want this?" And they push you away. That is communication right there.
Oh, absolutely
So
it is.
yeah, so autism, Down syndrome, acquired brain injuries, uh, you know, whoever needs the help.
Whoever needs the help,
Whoever needs
absolutely.
the
But
help. That's
the
right.
next question is, do you host like events for families, like hosting
Yes,
parties? Yeah. Oh,
yes.
awesome. There
So
you
we
go.
have we have done Thanksgiving dinners. We have done Christmas parties. And I mean, we've only been open for a year. So yeah, so we try to include family as much as possible because family is what's important, right?
Amen.
That's
Amen.
the
So to
biggest
follow up
support.
to that question, are you open to working with school boards and connecting with families?
Absolutely. Yes.
Okay.
Because there is a lot coming out of our high schools
Oh,
who
I know.
who need the programs, who need the socialization, who need to build skills to go further, in their journey. And
I would absolutely kill to live closer to you.
oh,
Well, no, I have my son who's 21 years old
yes,
and he's on the autism spectrum. Everyone knows Catcher.
yes,
Yeah, everyone knows Catcher, and he's very high functioning, but he needs that life skill direction. And if he had a place to, like, a center to go where there's other people like him all the time, that has similar struggles, it would be, I think, better for him. But it's hard to find that. You can't, like,
there's
there's
a
nothing. There's
there's a
nothing. I mean,
few.
no, and I'm not taking away from the mental health community support because he does phenomenal there and he does a great job with Janet.
Yeah.
I just wish we had the space that we could do something like that, but our spaces are really expensive down where I live. So we can't
Yeah.
really pull that off right now. But I think what you're doing is just amazing and also bringing kind of awareness to the fact that there is nothing after the age of 18.
Yes.
There's nothing out there, and like you say, respite or one-on-one, or like, you and I could have great big conversations over ideas that we both have.
Oh yeah.
But I mean, like, it's there's nothing out there. You're really filling that need, but you're not just filling that need in like a big urban center like Toronto. You're in Meaford.
Yay, me friend.
I love Meaford. It's a beautiful town. But I mean, you're in Meaford, which is, like, to me, it's just amazing that there's a center there. That's
Yeah.
that's phenomenal.
Yes. There are a couple other programs around as well. They're, similar. But a lot of them are waitlisted, because there's such a need. That they have a long wait list.
Yeah.
Um, so me adding to this really opens the door for more people, or maybe they can only do so many days there, need extra days here. That works too. But yeah, it is needed. And a lot of the one-on-one absolutely is for sure needed. And that's not just for DSWs, PSWs, can do the job.
Absolutely.
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 Even
Yeah.
the PSWs who are at the schools, working along EAs, they're providing the support there as well, which is great. Um, yeah.
It's amazing how the PSW profession as a whole has just expanded so dramatically. And I mean, I like to say that PSWs work from, ages 0 all the way up to 150. And then I say, but after 150, they're on their own. We're done. We don't take care of them after 150.
That's
But I
right.
mean, but we do, and we just don't deal with the elderly. We deal with every sort of cognitive, physical, emotional, issues. And PSWs can do those things. Like, we have our autism program that PSWs are being trained to work with those on the autism spectrum. I mean, it's such a important, skill
Yeah.
set for PSWs to have, because we're hearing more and more of families desperate for help for their young ones and young adults in the autism spectrum. And I guess I'm speaking specifically about autism currently, but that seems to be the big one right now. We're hearing the most of. And they just can't find the help. They don't know where to find the DSWs or the PSWs. There's not enough DSWs, so then they're unsure if PSWs can do it. And then, like you said, there's wait lists, and then what do they do during the summer?
Yeah. Yeah.
Right? Like, and some places as well are there are private places, not like yours, a little bit different because they charge an arm and a leg. Right? You got to be realistic, right? You got to be a bit realistic with some of this. But so kudos to you on your, on your center, on what you're doing. I mean, if you had any bit of this being PSW week, if you had any bit of advice for, the new PSWs coming out into the fields, and veteran PSWs looking to change their careers, and change their scope, shall I say, in as being a PSW, what would your advice be?
Just don't be afraid. There's lots we can do. Think out of the box.
Yeah.
We do a lot. We're compassionate, we're caring, we're loving, we support people, when they need the support the most. And if you've gone through and you became this PSW, it's in you. And we don't just need to work in long-term care. you know, just
Or
go
home care.
put yourself out there, you never know. And like working for yourself is a wonderful aspect as well, right? So yeah, like we can do this, I'm doing it.
I did it. Like
Yeah,
it's,
there you
yeah, I
go.
know, right? Like it's being a PSW, I find actually, I think is a great profession because you're being on, like we can do anything.
Yeah,
Like we got to get it out of our minds that it's only long-term care, only home care, that the big paying jobs are just hospitals. You, if you love what you do, you can build a career or around what you want to do.
yeah.
And that's what you've done, Natasha. And that's what I did. I didn't know I'd ever get this far. But I mean, it's, like that's what I did, right? You see a need and you fill that need. Doesn't matter, you don't. So I mean, PSWs, the sky's the limit, I like to say. It's limitless as a PSW.
And we're not just a PSW. We are PSWs.
I
Yeah,
would say we are the
that's
PSWs.
right. Absolutely.
Absolutely. So everyone, we're going to be posting links below where you guys can find Natasha, find her center, find information out on what she's been up to since her COVID-19 warrior days. And stay tuned this coming week, PSW week. There's going to be a lot of posts on our social media. I'm going to be going live again on Monday with Natasha Muller, who is a veteran PSW and a fellow classmate of mine from my PSW program back at Mohawk College. And we're going to talk to her, another entrepreneurial PSW. I'm seeing a trend with this PSW week. And yeah, so stay tuned for this, Natasha. It is always a pleasure to
Thank
talk to you,
you.
even though we
You as
never have
well.
time to talk. But it's always a pleasure to talk to you. Anything we can do, you have OPSWA's full support.
Thank you.
So just let us know. And with that, everyone, happy beginning to PSW week. Thank you for everything you do. Remember, if you don't, or if you're not a member yet, jump on it, www.opswa.ca, click on memberships. And with that, I'm going to say, thanks everyone, and OPSWA out.